Christine. I'm an occupational therapy assistant. An occupational therapist teaches specific techniques to patients in order for them to reach their daily activity goals. So today in this video, I'm going to show you, the family member, how to do passive range of motion exercises after the patient right here has had a stroke and is experiencing left side weakness or slight paralysis. These passive range of motion exercises will help the patient to decrease pain and stiffness, increase the circulation in their arm, which helps keep the joint healthy and more mobile. So I want you to watch and listen, and you'll follow what I'm doing. You want to use both hands and place them gently and firmly on the patient, but use soft hands while you're performing the passive range of motion exercises. I'm doing all the work, and the patient's not doing any work at all. And that's the same for you. I'm doing the work, and you'll be doing the work as the caregiver or family member. Ask the patient also frequently during the movements, after every couple movements, how she or he feels, because they should be not experiencing any pain. So probably ask 2 or 3 times during the whole exercise routine from start to finish. You need to stop if they're experiencing any pain and notify your doctor and occupational therapist. You're going to need 2 chairs, one for the patient to sit in without any arms, as you see here, and another one I have behind me that I'm going to scoot up later so that I can sit in for the end exercises that we're going to be doing. You'll also need a table, so if you want to seat the patient next to the kitchen table, or I have a tray table that I'll move in later, that's just right. Okay, so we're going to start. We're going to be doing the shoulder exercises, elbow, wrist, and hand. We'll start with the shoulder. For the shoulder extension and flexion, you're going to place one hand just next to the shoulder joint between the shoulder and the neck, and then your other hand is going to be under the patient's upper arm, and you're going to lift and release down. You're still holding, you're lifting in the front and down. You're only going up to the part of slight resistance. Lift and down. When you feel a little tension, you're going to stop. You're going to do each of these exercises 5 to 10 times, and that is 10. Great. The next one, we're going to go move the arm out to the side. You're still putting one hand in the placement up here next to the shoulder, and the other one is in the upper arm. And we're going to move the patient's arm out to the side. Up and down. Okay, out to the side and down. And again, I'm only moving up till I feel slight resistance. How are you feeling?
Good.
Okay. Are you experiencing any pain?
No.
Okay. And each of these is done 5 to 10 times. And there, that's 10. Okay, so for the next one, we're going to start with the arm out to the side like this. I'm still holding the upper arm in between the shoulder and the elbow. I'm holding the upper arm. And my other hand is still resting on the shoulder. And we're going to move the arm in across the body and out. In and out. Now it's important to keep this level right here, the upper part of the arm with the shoulder. You don't want it too high or too low. And we're going to go in and out. Now notice where I'm standing during all of these exercises. I'm at a diagonal to the patient. You're going to do this 5 to 10 times. I'm not in front and I'm not behind. This is allowing me to get proper range of motion while I do these exercises for the patient. And 10. Great. You can return the arm to, this is a neutral position when you're changing the exercises. Okay, now I'm going to lift the arm up again in the same position, This time, my first hand is moving off the shoulder and under the forearm. And then I'm going to place my second hand between the elbow and the wrist. All right? So this hand under the upper arm is going to stay stationary. And then I'm moving the forearm hand down and up, down and up, down and up. 5 to 10 times. So my hand under the upper arm is staying stationary in its place, and I'm just moving my hand so I can, the other hand with the forearm in it. And that's 9 and 10. Okay, great. Now we're moving, that's enough for the shoulder, so we're moving on to the elbow exercises. I'm going to do the flexion and extension of the elbow. So what you're doing is you're putting your hand, one hand under the forearm and one hand behind the upper arm. And I'm going to be moving my forearm again, but this upper arm is going to remain at the patient's side. So I'm moving the forearm up and down, up towards the body and down. So the arm is straight again, up and down, up, back toward the upper arm and down. And 5 to 10 times. And again, my first hand holding the upper arm is just keeping the upper arm stationary against the patient's side. And 10. You want to keep your posture good. You're going to experience some leaning, but make sure your legs do all the work so that you don't injure your back. All right. So I'm going to bring the table next to the patient. Now for the purposes so that you can see this better, I'm going to turn the patient, but you don't need to if your patient's already against the kitchen table. All right. And this is where I'm going to have a seat. Okay. Rest the patient's elbow on the table so it's in a relaxed position. And this time, I'm going to hold the upper arm so that I can help the patient stabilize the elbow. And then I'm going to place my hand on the forearm between the wrist and the elbow, but a little bit closer to the wrist. So we're gonna move the patient's arm in a little bit of a rotating twisting motion. We're gonna rotate it palm up, palm down, palm up, palm down, palm up, palm down. My first arm is just helping to support, my first hand is helping to support the upper arm. And you'll do this 5 to 10 times. Palm up, palm down, and that's 10. Okay, great. Now we move on to the wrist. Again, the elbow's gonna stay on the table rested, and we're gonna do some bending of the wrist. So my first hand is gonna move to between the wrist and the elbow, closer to the wrist, but not on the joint. And I'm gonna hold the patient's forearm. Then my next hand is going to go in the palm with my fingers in the palm. I'm gonna move the wrist back towards the body and down towards the table. Back towards the body and down towards the table. Back towards the body and down towards the table. Great, and that is 10. 5 to 10 times. How are you feeling?
Good.
Okay, are you experiencing any pain?
Mm-mm.
Okay, so for the last wrist exercise, we're going to move I'm still going to hold the forearm with my first hand, and then I'm going to move the wrist in a side-to-side motion. First moving thumb towards forearm, and then pinky back towards the forearm. So here we go. Side to side. Thumb, pinky. Thumb to forearm, pinky. And that's 4. in a side-to-side motion. Thumb to forearm, pinky to forearm. And 10. You're doing great. Okay, now let's move on to the hand. I'm going to move my hand down from the wrist, and now I'm gonna put my hands on, my first hand on the patient's hands, and we're going to bend these joints here to exercise them, to stretch them. So my next hand is going to just hold all fingers, and I'm going to go back and bend them towards the table. I'm going to go back towards the patient's body, and then I'm bending the fingers towards the table. Back and towards the table. Gently back and towards the table. Back and towards the table. Back and towards the table. So you're just exercising those knuckles, and that's 10. Remember, you're only going to slight resistance. When you feel that resistance, stop. Okay, now I'm moving my hand up the patient's hand, and instead of holding my first hand on the hand right here, I'm going past the knuckle and the next soft place between the knuckle and this other joint right here, up the finger, the middle joint of the finger. I'm gonna place my finger and my hand there. Then we're gonna work on moving and exercising this next middle joint of the finger. My next hand is going to be holding all the fingers again. So I'm going up and back. We're only bending the one middle joint of the fingers. Up towards the patient's body and down towards the table. Up and down. Up and down. Up. So you're exercising all these 4 fingers at one time. You're gently holding them in your hand. Up and back. And that is 10. Okay, and then the last finger movement, we're gonna do one at a time. So lay the patient's hand on its pinky end, resting on the table. And again, during these whole exercises, the forearm and the elbow joint is resting on the table. So you're gonna take the tip of the finger, and you're exercising the tip of the finger this time. So I'm gonna hold the patient's finger one at a time, just towards the patient's body below that pinky tip, the tip of the finger. And I'm gonna bend it back and forward, back, and I'm bending towards the camera and away and towards. You're gonna do each of these fingers 5 to 10 times. And 10. I'm resting that finger, I'm moving on to the middle finger. And again, I'm holding it in the same place. You're holding in the soft place in between the joints, in between the bones. And my second hand is on the tip of the finger. And I'm moving it back towards me and toward the camera. Back and towards the camera. Just to the point of slight resistance. Okay, 10. And to the next one, the ring finger. Back. Is your arm relaxed? Good. How do you feel? Good. Same movement. And last for the pinky. Back towards the camera. Back towards me. Towards the camera. Back. And that's 10. Great. The last thing is the thumb. We're going to be moving the thumb away from the fingers and then back towards the fingers. Away from the fingers and back towards the fingers. So my first hand is going to hold the fingers gently. And my second hand is going to, I'm using the first 2 fingers, my index finger and my middle finger, to hold the fleshy part of the palm just beneath the thumb. And then my thumb is going to be on the top part of her hand, just at the bottom of the thumb. Not on the hard part, as you see here, but just below on the soft part. And we're going to move this hand that's holding the thumb out, in. We're moving the thumb out and in towards the fingers. Out and in. Gently to the point of slight resistance. Out and in. Out and in. And do this 5 to 10 times, and that is 10. Great, that completes our session for today. Thank you.